Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Today, a special cannabis clinic for patients with cancer. The legalization of cannabis continues to spread across the U.S., making patients more interested in its use to alleviate side effects during cancer treatment. HealthPartners' Frauenshuh Cancer Center in St. Louis Park, Minnesota, developed a clinic to help educate patients and their caregivers on safe and effective cannabis use, and then track their data in a registry of participants and their outcomes. Sarah Jacks is an advanced practice provider who helped create the Cannabis and Cancer Research and Education Clinic, or CanCaRE.
Patients want information from their cancer care providers, but we learned that a lot of oncologists do not feel well informed to make clinical recommendations to their patients. 85% of oncology providers wanted more education about medical cannabis, so we felt that developing the CanCaRE clinic was an opportunity to not only provide patient education, but come back to oncologists to provide them with information about medical cannabis, trends on symptoms, and better dosing regimens.
I would imagine that the demand for education from the providers and from patients is increasing.
Correct. Minnesota has a Minnesota Medical Cannabis Registry that is a newer program that is only available to patients with qualifying conditions. This program is growing dramatically, and we found that patients wanted more information from their cancer providers. And as a result, we felt that developing a clinic was going to be the best opportunity to provide patients with not only cancer and cannabis education, but dosing strategies and different symptom management recommendations.
Walk us through that referral process.
So it is a self-referral process. So patients are provided information in clinic on our medical cannabis program. Physicians are also able to refer patients to the program if they see a patient in clinic who expresses interest in learning more about medical cannabis. After the referral happens, they meet one-on-one in a virtual consult with an advanced practice provider such as myself or my colleague. These visits are typically 45 to 60-minute virtual visits to provide this patient education.
What does the staffing model look like for the clinic? I understand that you provide a certain amount of one-on-one consultation time.
So our clinic has been running for approximately 18 months. Initially, the clinic was run just by myself, with approximately 4 hours a week providing medical cannabis education. Starting in 2022, we had another advanced practice provider, a physician assistant, join our group to provide additional consults one-on-one with the patients.
Sarah, what are some of the benefits of cannabis use during cancer treatment?
I think cannabis is a newer agent to provide symptom relief. We have found that patients experiencing pain, nausea, insomnia, sometimes anxiety or depression benefit from cannabis because of different dosages and ratios of THC and CBD working together.
Are there any patients that cannabis doesn't make sense for?
Actually, that's a really great question. We do a medical history review during the initial consult with our cannabis patients, and we found that patients with schizophrenia or acute angina or heart problems may not be the best candidates to use medical cannabis.
What about patients on immunotherapy?
When we do our initial consults, we review the patient's treatment plan that they're currently receiving. There is some data showing that some immunotherapy drugs, if used with cannabis, may not be as effective for the patient who is receiving immunotherapy.
How is your clinic working to create cost-effective programs for patients?
Yeah, so one of the highest barriers to patient use of cannabis is the perception of how expensive the product is. In Minnesota, medical cannabis is not covered by insurance. As a result, it is a cash-based program that also requires an initial $200 registration fee. This registration fee is once a year and can be cost prohibitive to the patients. So with CanCaRE, we strive to create cost-effective plans through individual dosing regimens for our patients. We walk them through the different dispensary product lists, specifically how expensive each product is. We learn the budget of the patient prior to making product recommendations. We then work with them to provide dosing recommendations with different products.
How has your clinic added to your overall services in your cancer center and the patient's quality of life?
So at Park Nicollet Frauenshuh Cancer Center, we have a very robust amount of services provided for the patient, specific to education, quality of life, and other services such as social work, music therapy, nutrition services. We felt that symptom management was such an important part of the patient's quality of life. We find that symptom management is so important to patients and that using some novel agents like medical cannabis can be so helpful to improve their quality of life.
For more on the Cannabis and Cancer Research and Education Clinic, you can check out the latest issue of Oncology Issues in your mailbox and online, or you can read the show notes. Next week on Cancer Buzz, digital literacy for older adults in cancer treatment. Until then, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.